السلام عليكم. أنا دكتورة هالة. هنعمل إن شاء الله ريفيجن على الثايرويد and pituitary glands. Here is the site of thyroid gland. بتتكون من two lateral lobes connected by isthmus. This section is a coronal section in the region of thyroid gland. This is the lateral lobe thyroid gland. This is the true fibrous capsule, greenish, and this is the false facial capsule, orange. Sensory ligament of Berry. And this is the suspensory ligament of Berry, here. This is a cross section in the neck. This is the thyroid gland. This is the lateral lobe, the isthmus. Relations of thyroid gland are here the anterolateral relations, here medial relations, and posterior relations. Anterolateral relations are muscles of the front of the neck, which are sternohyoid muscle. Behind it, sternothyroid muscle. And this is omohyoid muscle. And this is a sternomastoid muscle. Medial relations are trachea and esophagus behind it. Posterior relations are internal jugular vein, common carotid artery, vagus nerve in between. On this model, here is the common carotid artery. And this is the internal jugular vein. Blood supply thyroid gland. Here is the arterial supply. This is the superior thyroid artery. And this is the inferior thyroid artery. And this is the thyroid-shaimaa artery. May be absent. There is important relations of the arterial supply of thyroid gland to important nerves here. Here is the superior thyroid artery, and this is the external laryngeal nerve from vagus. External laryngeal nerve. The superior thyroid artery, external laryngeal nerve meet each other away from the gland. Here is the inferior thyroid artery, and this nerve is the recurrent laryngeal nerve. They meet each other close to the gland on its posterior surface. This is the venous drainage of thyroid gland. Superior thyroid vein, middle thyroid vein, inferior thyroid vein. دلوقتي هنتكلم على ال pituitary gland. Here is the site of pituitary gland, the hypophyseal fossa. This is the upper surface of the body of sphenoid bone. This is an elevation called tuberculum celli, and this elevation is called dorsum celli, and the fossa in between is called hypophyseal fossa. These three structures are called sella turcica: tuberculum celli, hypophyseal fossa, and dorsum celli. This is a sagittal section in the head and neck. This is the skull base. This is the sella turcica. Elevation, then depression, then elevation. Sella turcica. Tuberculum celli, hypophyseal fossa, dorsum celli. And here is the pituitary gland. The pituitary gland is connected to the hypothalamus by the infundibulum, and this is the hypothalamus. This is the anterior lobe of pituitary, and this is the posterior lobe. Relations of pituitary gland. This is a coronal section in the skull. This is the body of sphenoid bone. Here is the pituitary gland. Above the pituitary gland, there is the optic chiasma. Below it, here, sphenoidal air sinus. On each side of pituitary gland, there is the cavernous sinus. Inside the cavernous sinus are these two structures, internal carotid artery and abducent nerve.